The most important thing in ear reconstruction is symmetry. And this symmetry, besides matching the healthy ears, in size, angle, and contour, every person's ear has its own unique characteristics. For example, this ear, angle, and the integrity of the structure in front of the ear is very well developed. Now this ear, as you can see, is a rather obvious case of incomplete structural development. For example, it lacks the antihelix, the outer rim of the ear. Its triangular fossa and the width of the ear are also incomplete. So for ears like this, we can observe the first two have the external ear higher than the antihelix, but there are some differences in angle details. In this case, the antihelix is higher than the external ear. This one, however, the external ear and the antihelix are at the same height. So when we reconstruct the ear, we must pay attention to these details. We try to replicate the same details and characteristics as the healthy ear. This is the situation for the front of the ear. We can also observe the difference between this ear and that one. If we compare them individually, we can look at the back of the ear. We can see the skull here, and this is the ear. The position of these two ears behind the head, and the angle between them and the skull, are different. In this case, the angle is a bit larger, so the ear is more three-dimensional. On the other hand, for this ear, the distance between the ear and the skull is small. We call it a small cranioauricular groove. At the same time, ears like this are closer to the skull. It's a very three-dimensional ear. When reconstructing the affected ear, we need to make it stand out as well. If the ear's features, like the upper part of the ear, are very close to the skull, we should also replicate the same features on the healthy ear as well. This way, the appearance of both ears will be similar. Of course, some ears have distinctive characteristics. Like this one, it has accessory ears in front of it. Usually, we can remove them during the surgery, making the ear area smoother. This helps make the area in front of the ear flatter. Thus, ear reconstruction surgery is indeed very challenging. It's not just about creating one ear. We aim for the ear to match in size, width, and angle. We also focus on replicating the personalized front contour. We strive to create an ear that looks as similar as possible. This way, the post-surgery result will be more lifelike, and it will be harder for others to notice.